Good day again, everyone. So, today we are also going to talk about understanding the herd health management. Okay. So, when we heard or pag nadinig ba natin yung herd health management, ano ba ito? So, that is the traditional role of herd health. So the traditional of this term is to control or eliminate the diseases and management efficiencies that impact on animal welfare or limit productivity. The framework of herd health control is risk monitoring and assessment in conjunction with the best farming practices. So, napaka-importante pala ng role ng herd health management. Dito natin ang mapapanatili kung ang isang baboy ba natin ay malusog, hindi stress, nag-gain in weight, and also hindi rin siya nagkakasakit at nalilimit din natin yung uh, pro- uh, product losses. So that is the main role of herd health management. Okay? So as you can see, nagbibigay tayo ng mga iba't ibang vaccine to maintain the healthiness of our hogs. So napaka-importante nito kasi kailangan natin mag-vaccine ng deworming, vitamins, iron, and other things na kailangan ng ating alaga. That's why herd health management is very important. Okay? So as you can see here, I have different types of vitamins, irons, and deworming. So those are the things that I used or that we used in technical service. And makikita nyo po yung aking pang-injection. So ito po ay isa rin sa isang ginagamit ko in technical service. So vitamins and syringe. So, what is the importance of herd health program? Number one is the biosecurity, adding breeding stock to the herd, routine health procedure, vaccination programs, internal and external parasite control, slaughter check, monitoring, and feed additives. So, that those are the things that that is important and very helpful to our herd health management program. Okay, so for the next slide, we are going to talk about the biosecurity. Biosecurity is the practice of managing the herd so that the least possible potential exists for bringing in disease with people, pigs, uh, wildlife, and mechanical vectors such as tires, tools, others, and perhaps the most important health consideration for a seed stock. So, strict visitors policies should be enforced with only necessary personnel allowed to access to the pig areas, requiring visitors to shower in with a complete change of clothes into those provided by the swine unit. It is a good preventive practice. Movement directly from another swine farm onto the seed stock production herd is too risky to allow. So, biosecurity. Ito, napaka-critical. Nung mga nakaraang buwan, taon, lalo na nung pandemic, ito ang isa sa pinakamahirap na naging parte ng hog industry, lalo na nung nagkaroon ng ASF. Kasi ang ASF ay alam naman natin na ito ay isang flu na hindi kayang gamutin at ang tanging paraan lamang ay patayin ang hogs na magkakaroon ng ASF. So, biosecurity is one of the main important thing kasi kailangan natin tong sundin, and also kapag pupunta tayo sa isang farm or backyard, kailangan natin magsuot ng proper suit such as scrub suit. But some of the hog raisers don't allow visitors because of high biosecurity, kasi talagang may sakit ng ASF na nakakahawa talaga, and that is understandable. Okay? The next one is adding breeding stock to the herd. So, all incoming breeding stocks should be quarantined in isolation for 30 to 60 days, a minimum of 200 yards from the primary herd. So, 30 days is a minimum period for adequate isolation and observation for new breeding stock. So, longer period is 40 to 60 days or even more security. So, the initial 30 days time period is used to observe the stock for any signs of illness. During this period, feeding and animal care should be conducted at the end of the working day by employees who will not return to the main breeding herd. So, clinical signs of illness disqualify the stocks from addition to the main herd. So, a reputable supplier would be expected to notify the owner of the receiving herd if a disease break should occur in the source herd during the 30 to 60 days quarantine period. So, kapag tayo ay bibili ng isang stock or hogs, talagang ginagawa natin to, yung i-quarantine natin sila ng 30 days to 60 days. Why? To secure kung may sakit ba ang baboy na nakuha natin, kung meron ba siyang deficiencies, and to know if it is a good stock. So, kailangan talaga natin tong gawin. Not because dahil gusto nating isama ay pwede na agad. No, kasi it will give stress to those added stock sa ating baboy. Siyempre, nag-iba yung environment, mag-a-adjust pa yung ating ano. Kaya, dinalagay natin sila sa isolation room, or they are quarantined for 30 days. Okay? So, for the next slide, I'm sorry. So, routine, the health procedure. So, herd addition should originate from source of high health status. Precautions should be taken in locating and designing the facility and in introducing new breeding as a stock, as discussed in the section on biosecurity. Because of the prevalence of and impact of specific diseases, a vaccination program is usually practiced. So, stringent prevention program involving biosecurity practices and routine isolation and quarantine of new animal, combined with a routine surveillance and action where necessary, are the best health procedure. So, napaka-importante rin pala ng routine health procedure. Bakit? Kasi napapacilitate nito yung mga bagong dumating, and malalaman natin kung ano-ano ba yung mga proper vaccine na kailangan nating ibigay. Okay? So, for the next slide. Okay. So, vaccination program. So, dito napapasok si vaccination program. Vaccination programs is a combination of leptospirosis, parvovirus, erysipelas vaccine should be given twice at least 2 weeks apart to all incoming breeding of animal, and it should also be given to all sows at weaning and boars twice annually. Pigs should receive erysipelas vaccines at weaning. So vaccination for these diseases is recommended because of surveillance of the organism and the relatively expensive cost of the vaccine and the relative effectiveness of the vaccines. Other vaccines must be evaluated on the criteria of risk, disease, cost, and effectiveness. So, kung kailangan nating mag-isolate or mag-quarantine ng baboy, dito na papasok si vaccination. Kagaya nga ng sinabi ko kanina, vaccine medication should be given as required as possible. Okay? The next one is internal and external parasite control. All incoming breeder stock should receive 2 treatments, 2 weeks apart, with external and internal parasiticide. So, fecal samples monitored quarterly from each production area to determine the presence of internal parasite to allow further refinement of the deworming program. So animals in all phases of production should be observed routinely for the sign and external parasite. So skin scraping should be conducted on a number of breeding animals appropriate for the size of the herd every 6 months to check the external parasite. An external parasite control program can be designed based on the result and monitoring. So, napakahalaga rin ng external and internal parasite control. So, makakatulong to para makaiwas ng pagtatae or para ma-determine natin kung bakit siya nagkakaganon. Okay? Next one is slaughter check. So, quarterly slaughter check for the presence of gross lesion and ascarid migration in the liver, pneumonia in the lungs, and atrophic rhinitis in the nasal turbinate are recommended. So the skin and joints and intestinal and reproductive system can be also observed during slaughter checks. Finding can be caused to estimate the presence of disease in the herd to refine the healthcare management. Napaka-importante rin pala nung malaman natin ng slaughter check. Okay? So, monitoring. So, monitoring is a positive culture result and must be correlated with clinical signs and slaughter lesion before a specific recommendation can be made concerning the significance of culture and findings. So, monitoring the lesion at the slaughter has been described. Lesion observed at slaughter indicate that the organism which caused particular lesion may be the presence in the herd, but do not confirm their present. Different organisms may cause the same type of lesion in many cases. Monitoring, napakahalaga nito pa. Isa rin to sa mahalaga. So, without monitoring, we cannot identify what parasite are present in our hogs, what vaccinations are we going to use, what are happening or what is happening during the quarantine period. So monitoring is one of the important thing in terms of herd health management. Okay, so feed additive. So what is feed additive? So feed additives growth from promotant antibiotic usually to provide an advantage in the early phase of growth up to 125 pounds, and it may be useful to run on their farm trials in the finishing phase to determine the economics on return on their use. So the return in general is much smaller as the pig increase and the size may be negligible in a herd with high health status. There is often some concern about masking health problems with feed additives antibiotics. However, if the growth promotants are minimal and therapeutic, activities are used. So these concerns should be minimized. The simplest approach for many seed stock producers is to omit feed additives in finishing so that growth performance can be evaluated based on genetic merit within the limitation of the facilities and subclinical diseases is not masked. So feed additives is also one of the important in terms of health herd management. Kasi kung wala naman tayong feeds, di naman mapapalaki ang ating baboy unless you are going to use organic materials. Okay? So what are the most common health program? So the common health programs for piglets, growers, and breeders. So piglets take care of newborn piglets by providing guardrail. So ang guardrail ay yung kanilang magiging kulungan pansamantala while habang nanganganak ang kanilang mami. So treat and disinfect the navel cord with tincture of iodine as soon as it cuts with the sharp knife. So, ito yung mga practices na ginagawa natin kapag sila ay biik pa or bagong panganak. Okay? So, protect the piglets against the extreme weather condition, particularly during the first 2 months. Needle teeth should be clipped shortly after birth. So, why do we cut the needle teeth? Because 'di ba pag tayo ay or kapag ang baboy ay hindi naputulan ng ganon, magkakaroon ng chance na makagat niya ang breast ng kanyang mami. That may lead to stress sa mami or sa mami pig. Also, baka magkaroon ng bad mothering ang kanyang nanay pagka laging nagkakasugat ang kanyang nipple. So, vaccinate the piglets as per recommended by vaccination schedule. The piglets meant for sale as breeder stock must be reared properly. So, male piglets not selected for breeding should be castrated preferably at the age of 3 to 4 weeks, which will prevent the boar odor in the cooked meat, thus it enable production of the quality meat. Additional feeds requirements of lactating sow must be ensured for a proper nursing and all piglets was born. So, kung makikita nyo itong isang technical service namin, parang ito ay ilang araw pa lang nakakapanganak. So, we are giving some vaccination. So, itong binibigay ko dito ay iron ng mga panahong yan. So, ito po ay sa Tagaytay, malapit sa Crosswind. So, for growers, vaccination is a key health management tool to enhance individual herd immunity. So, commercial vaccines are available for most of the important swine diseases. And when commercial vaccines are not available, autogenous vaccine may be as possible. So, as you can see, ito na yung grower part. Kanina, yung pinakita natin ay biik. So, napaka-importante din ng vaccination sa grower. Okay? The next one is the breeder. So, management of the reproductive herd is commonly conducted with a combination of closed herd genetic approach, where genetics are maintained from the stocks on the site, and through purchase sows, boar, and the same in true breeders and the live auctions of boar stud. So, as you can see, tingnan nyo, ang ganda-ganda ng mga baboy na nabibisita natin. So, importante rin pala yung ginagawa nating canvassing kapag tayo pupunta sa mga farm. Okay, so that is our lesson for today. Thank you for listening and I hope may natutunan po kayo.